All righty. Hey, how you doing today? I'm a little bit late and sorry about that, but uh, I was working with somebody and it went over. It's unusual for me, but hope everybody's doing well today. And I'm gonna make this short because I have heard that John Lewis's funeral is going on today. Um, or the lying in state in Atlanta actually is going on today. And a lot of people are watching that. So I just want to come on today and talk about mental health before July is over. We're talking Black mental health in the month of July. And I've talked about leaky gut quite a bit. If you haven't heard about that, I'd recommend you go back and look at some of the videos over the past 3 months. I've talked about it numerous times. And that's really at the root cause of a lot of us having mental health issues. So there's quite a number of people that are talking about mental health issues on YouTube and online that are not medical doctors. And I appreciate them, and they have a lot to offer, and have been talking about various interventions. And what I think that people don't think about is that you could have problems with your levels of nutrients, and that can cause you to have a mental health issue. The level of nutrients that may be of relevance when looking at mental health boil down to the B vitamins like B1, 2, 3, B5, B6, B12, and folate. Many of the B vitamins have to do with methylation. So methylation is a process that happens in the cells and in the liver, and it helps the body to detoxify. B vitamins are also playing key roles in the metabolism of carbohydrates. And many people have depleted their B vitamins because they're either taking medications, or they're not eating enough green leafy vegetables, or their B vitamins are depleted because they're just eating processed carbohydrates, and they're running up their blood sugars, and that will drive the B vitamins down. And it's interesting because if you're taking the wrong form of some of these B vitamins, that will also drive down the level of B vitamins. So nutrition is important. Absorption and digestion are important. And also getting the right nutrients in the right forms. I'll give an example of the right form of a certain B vitamin. There's a form of B vitamin that's a folate, and folate comes as folate, folinic acid. It comes as tetrahydromethylfolate. And there are different genomics that dictate which form of folate is best for a person. For instance, if someone has COMT, which is an enzyme that participates in methylation, if they have a COMT defect, then they may need or benefit more from other forms of B12 other than methyl or cyanocobalamin. Now, these sound like big words, but I promise you, if you pick up your multivitamin and look on the label, you'll see that it probably has either cyanocobalamin, which is a cyanide form of the cobalamin B12, or it may have methylcobalamin, which is a methylated form. There are other forms of this B vitamin that exist called adenosylcobalamin and hydroxycobalamin. And those forms are dictated by certain genomics. And I can explain that genomics more to you if you decide to become a practice member in my practice. But just understand that not everybody takes the same form of vitamins. Not everybody can metabolize the same form of vitamins. And there are certain foods that certain types of these vitamins come from. And I'll mention here that I've had a lot of success and seen patients having a lot of success with using the epigenetic testing with Regenerate. And I've mentioned this before and I've posted on it before. It's spelled REGENR8.pro/1589. So if you go there, you can purchase the epigenetic test, and when the result comes back, which you can do the testing at home, when the result comes back, I can review that with you and we can come up with a treatment plan. There's also a superfood that is customized based on the results of this test, and that is called Optimate, and you can find that on the same webpage at regenerate.pro/1589. So this testing takes genomics into account by looking at very detailed organic acids testing, and it's very helpful. So when it comes to mental health, many times when we're depleted in the B vitamins, that can cause anxiety, or if we're taking too many B vitamins that are not for us. Because some people, maybe you're over methylating by taking methylcobalamin and you have the wrong genomics for it, that can make you feel anxious. Maybe you're not getting enough selenium and that's causing problems with your thyroid. And that could be rectified if you knew about it, and you could take selenium, which is found in Brazil nuts. So mental illness like anxiety, depression, PTSD can have close ties, and most times do have close ties to nutritional status and how much is being absorbed in the digestion and how good the digestion is. So I hope this helps some people. I'm going to post up the Regenerate website, and you don't have to have an order. You can go ahead and get the testing done, and when the result comes back, I'll let you know. I do have a discounted price for doing a 30-minute visit to go over the results. So some people are liking that during COVID because we need to be as healthy as we possibly can be. And this is testing that's accessible to everyone. It's around $300, costs much less than getting organic acids tests, which usually costs a couple $1,000s. So, and this is useful because it tells you what specific nutrients are in deficiency, and it tells us how to make a supplement that's customized for you. So thanks for stopping by to look at this video, and I hope you enjoy the rest of your day. My name is Serena Satcher. I'm a medical doctor, and I specialize in integrative and functional medicine. Maybe I'll also put the link for a podcast that I have participated in for veterans. And anyways, let me know if you have any questions about what I talked about today. Let me know if you have any requests or if you're interested in seeing me in my private practice, which is by telemedicine. And I usually see patients on Thursdays and Fridays. And we can agree on a time, and I have certain paperwork and I have an orientation. So let me know if you're interested and I will get you started with the orientation. Take care. I also have talks that I give once a month on Thursdays, and the talk for the month of August, I will be marketing for that and announcing that soon. So stay tuned. Thanks for tuning in. And if you want to see a recording of this, I will be posting it on YouTube. On my YouTube page is treatyourselftohealth.com, and Instagram, I have posts about my garden on Instagram, and that's treat yourself to health. Both are treat yourself to health, not .com. Treat yourself to health for Facebook, Instagram, and YouTube. Thanks for coming by, and hit the like. If you're watching this on YouTube, please hit the subscribe and hit the bell so you'll be notified when I do another video. Thank you.